Hello everyone and welcome back to the Digital Health Wire show. My name is Jason Berry and I'm excited to be at Health Las Vegas Day 2. I'm swinging by the Solera booth and I'm joined by their Chief Medical Officer, Dr. Saeed. Dr. Saeed, thanks for coming on.
Nice to meet you.
So the payers and providers they're working with many of the companies that we have behind us on the show floor. You kind of help them. Could you give us an overview of the platform and how you kind of help them untangle that web?
So our digital platform basically curates all the best-in-class digital providers, virtual providers in various healthcare conditions, from mental health to musculoskeletal pain and other conditions, hypertension, and puts it in one platform so that, for example, a payer or an employer that is trying to identify what are the right solutions for their members can look in one place, a very curated curated set of providers that has been analyzed to make sure that it meets clinical rigor, that it meets the highest standards of data safety, that it meets the needs of their employees, but at the same time, it contains costs.
Payers and employers, they're up against pressure from multiple fronts right now. How do you kind of help them come out on top? How are you helping them cut down on costs, use best-in-class solutions for their members? How are you getting that accomplished?
Yeah, so the typical employee or health plan member can be overwhelmed by the morass of different digital solutions out there. So imagine opening up a web page, you see 50 different potential digital providers. How do they navigate that? We've solved that problem by putting that all on one platform. We ask them very easy to understand questions to get to know each employee or member better, and then find the type of care that they need, and then find out, for example, which digital providers meet those needs. And for example, you might have 3 problems. You might have obesity, hypertension, diabetes. So do you pick 3 different providers for each of those 3 problems? Or can you actually find a digital solution that meets the needs for all of those problems within one digital provider? We solve that problem.
Nice.
And we do it in a way that contains costs for the employer and the health plan.
One of the big buzzwords, it's been a hot theme for years, but it's fast and furious at this year's trade show, is artificial intelligence and AI. It's on every booth. But you recently rolled out some AI enhancements to your own platform that really seem to move the needle from what I saw.
Yeah.
Can you kind of walk us through what those enhancements
so
were?
we're very excited by our Precision Insight Suite. It solves 3 different challenges. So one is it identifies the rising risk members. So those folks that employers or health plans are financially at risk for, where they're operating under the radar, but they have chronic conditions that can exacerbate and have very high cost utilization. We identify those types of folks early on. So that's what, with a precision intercept, we identify their gaps in care. And then on top of that, we use AI to use a very personalized matching by understanding each member and identifying who are the right providers, whether it's brick and mortar or virtual, that meet the needs of those members at the right time.
And if I'm a payer or a health plan and I'm trying to get my head on straight, untangling this web of options that are out there as far as point solutions to meet my members' different problems, what advice would you give me as like a first step that I can kind of start implementing on, start fixing, or path towards success there?
Yeah. My biggest advice is think about the network and have a wide lens. There are so many different digital solutions out there. It's very difficult to look at one solution in the absence of looking at what else is out there. So having a platform that looks at a network of solutions and identifies the right solution for each member with a different level of acuity and a different level of, and different types of needs is, I think, the key to providing the best experience for your members while containing costs for the health plan or the employer.
Dr. Saeed, getting the right experience, the right benefit to the right member at the right time, that's a worthy goal. And thank you for tackling it. Like it really shines through that you guys are fighting the good fight here. Thanks for coming on the show.
Thank you. Take care.
Appreciate it.
Bye-bye.
All right, everyone, that's been the Digital Health Wire show. Thanks for tuning in, and we will see you next time.